Now, what we are covering in this course is highly specific to anybody who's got a problem with their lower back or just wants to improve the function of their lower back. And that is because all of the exercises that I've integrated and all of the topics that we're covering is based on having seen thousands of patients, the issues that seem to come up again and again. So if I were to examine you one-on-one, pretty much everything that we've got covered in this course I would need to tell you. The difference with being able to examine someone one-on-one is that we're able to highlight a specific area that that person is maybe going to be weaker in, and then we can also come up with specific sort of time frames or sets and repetitions that would want to be done for a particular exercise. So the downfall almost of doing a generalized program is that you can't follow a specific plan of how you're going to be doing the exercises, and that's perfectly normal because there's going to be a whole range of people doing this course, and with everybody's variations, certain people would do better with performing the exercises perhaps more slowly to figure out the movements. Other people would pick up on it fairly quick, and then they can start loading and doing more sets and repetitions. So this program's got to allow for that variability. I wish it was as simple for you and for me to be able to just say, look, just do the exercises for 20 minutes, 4 times a week, or do each exercise with the 3 sets of 10 or 12 repetitions. But it just doesn't really work like that. It's a little bit more complicated, and you are going to have to feel and learn the movement patterns yourself. So everything has been set in particular order to allow you to do that. However, if you're looking to follow a specific framework, I've attached a PDF document that guides you as much as you can, or as much as I can guide you, so that you can come up with a formula that's going to work well for you. However, really, it is a bit of trial and error, and you are going to have to use your judgment. Remember, you know your body best. Even when I'm examining someone and I'll give them the best advice, I'm still checking with them to see how it feels, how they're doing with the plan, because somebody might prefer to exercise every day, but someone else might not. So I've given you concepts and I've given you things that you can look for in integrating and making your own plan. However, the plan is really, it's up to you. How much do you want or need to be getting out of it? There's a grey area here where there's no harm in training every single day with these exercises, but you might not need to. What I would look for personally is just the maximum effect with the minimum effort. So if I can stretch a muscle effectively and get it completely stretched in 3 minutes, I would much rather do that rather than spending 15 minutes on it. Now, both of those versions might give me 100% of what I need, but we obviously, if we can get it done in 3 minutes rather than 15 minutes, then that's what we want to do. So with all the individual exercises, I've shown you the specific and the best ways to do them, but when we're integrating them, you are going to have to figure out what your optimum rate is for training and for getting better. So some of the exercises we want to be focusing more on movement and control, and particularly at the early stages of the exercise, if you're learning it for the first time, I would advise spending a little bit more time practicing the motor patterns, the movement patterns, because there's no point just looking at the exercises and then rushing into it. So I would strongly recommend just spending time learning the movements, and that's for you to figure out. If you pick up on the movement really quick, brilliant. If it takes you a couple of days or a couple of sessions or even a couple of weeks with some of these problems that people may have, or some of the particular exercises, we might be highlighting a really weak point that you've got. And the idea is that we're progressing and moving through these once you've completed it and once that you're good enough to be able to do it. The ultimate goal is for you to be able to squat, for you to be able to lunge, all of the movement patterns. For example, you can use the golfer's lift, and just integrate that into normal day-to-day movements so that you're not going to injure the back, but also getting on to the next level. I've not come up with the course material yet, but if I was doing another course following on from this, we would be looking more at exercises that are going to get us stronger and that we can integrate in towards doing a particular sport, for example, running, swimming, or just training in the gym. Now, before you can do any of that, we need to do all of the foundation movements and exercises to be able to do that. So ultimately what we've done is broken those movement patterns down, movements such as walking, running and squatting. We've isolated all of the exercises and then we're building things back up. So basically things that I want you to look for, if you're practicing the movement, there's no sets and repetitions for it. You've just got to practice the movement. If you're good at it, that's when you can move on. If it feels like it needs a bit more work, then you add that into your next session or you carry on doing it the following week. Once you've mastered it, then we can start to exercise it. When we are exercising, this is typically where we would then refer to looking at sets and repetitions, because this is where we can focus more on trying to strengthen it. So if we're doing clamshells, for example, I may just want a very, very light resistance with the band, or just no band at all. And by doing 3 sets of 12, I might be fatiguing at repetitions 10, 11, and 12. So if that's my level at the moment, I'm not ready to add like a thick blue band, because I'm not going to be able to do the movement. If I'm doing that movement, then I'll probably be cheating. I'll be using different muscles, and what we want is to activate the specific ones. So after a couple of weeks of doing that movement, once I find that, oh, actually I could do 5 sets of 15, right, that's when we want to ramp it up a little bit, and we're going to increase by adding a little bit of resistance. Or it just means, right, we don't really need to do the exercise anymore. I can just add it in as an activation just to wake up the muscles, but then I'm going to be doing a single leg bridge, or I'm going to be doing squats and lunges. Because my glutes and my hips are much stronger, I can then progress the exercise. So going through the spine protocol, we've got the stretches that we can do first. And this is just because you can start to do stretches and you'll start to get the benefits pretty quick. With the isolation exercises, this could take anywhere from 2 weeks to 2 months to be able to facilitate and grow the strength and the neurological development of those muscles as well. And then we've got to integrate it into these more complex movements, squatting, lunging, and then eventually running. So there's the whole framework, and that progress, or that process rather, is why I can't say, yeah, do this for 3 times a week for 4 weeks and you'll get there. So realistically, any program that you'd be looking at that you would just buy as a one-off, it might well work, or it might be changing in a few weeks' time anyway, and you'd no longer be doing that particular program that you need. You should be doing a different one. So there is no substitute really for having someone watch your form and advise you on all the exercises. But the next best thing, if you're learning all these exercises on your own, is just to have that guide for what you're looking for, and then you can create your own programs. And certainly when I'm training at the moment, I'll have different sessions. One where I'm just looking at movement, and all I'm doing is feeling the quality of the movement. I'm feeling the activation of the muscles. I'm looking for the muscles to have, you'll feel a bit of a burn in the right muscle. And that means that, yeah, you've activated the muscle and you've trained it. If it's too easy, then you progress the exercise. And once you've got the hang of that, then you can look, as I said, at more of the strengthening based movements or strengthening exercises. And this is typically where we will be doing 3 lots of 8 to 12, which is going to be helpful for building strength. Or if you want to build endurance, we can just hold that particular exercise for longer. Or we can do higher repetitions, such as 15 to 25. So really, you can pick and choose different components of this. However, it is ultimately up to you. So that isn't a bad thing that we can't give you the right recipe, because everybody is an individual. You'll respond at your own rate. But at least you've got some things that you should be looking at. And later on, if you're doing a different course, maybe it will be a little bit more structured. But as soon as you get more comfortable with it being more structured, we'd probably throw something else at you to make it a bit more complicated. So it's just going to be a bit of a grey area until you've done the first couple of weeks and you've figured out your own protocol. And then you can pick and choose what things are working, areas that you need to maybe add in and do a little bit more, and then when you can progress onto the different exercises. But by all means, going through the spine protocol, that certainly is going to be a requirement for anybody who's wanting to improve the function of their low back. It's the starting point, and we're taking it to the point where basically you can run, jump, and squat. That's the point where then it would be moving on towards a different program for looking at making further improvements. But for now, just have in mind that the main aim is to learn the movement patterns, and we're breaking it down, and then you can just pick and choose the exercise frequency, the exercise duration, and then any particular sets and repetitions that you feel is giving you the most benefit. It's almost exercises and stretches. We want to be not doing too much that we're causing damage, but if you're only doing 3 minutes a day and you're doing a couple of things, just dabbling in it, it's not going to be worth it. It's not going to give you any results. So you need to find your own sweet spot for what's going to work for you. And as I said, it is just a bit of educated trial and error. So give it a go. Any questions, let me know, but you'll be fine just following our spine protocol. It's all laid out in a particular order, so have fun with it, enjoy, best of luck.